Hello viewers, welcome back to Candid Conversations with Ganesh Kuppala. Thank you so much for response that has been given to this show. As you have seen in the recent times, I've been talking to various specialists in the field of healthcare, and we had multiple doctors on the show previously. Today, I have privilege of bringing another doctor who's all the way he traveled to UK from India, attending Commonwealth Medical Association international convention, sorry. So he's here. Dr. Prabhukumar is with us today, who's the convener for Artificial Intelligence and Digital Health, Commonwealth Medical Association. And he's also heads the Hyderabad Indian Medical Association as well. And he also heads a lot of other organizations and different committees.
Yes.
Thank you so much, Prabhukumar, for all your work that has been done in the medical associations and all. So thank you so much and welcome to the studio.
Thank you, Ganesh, for inviting me for this, program, and it was wonderful to come here. As you know, I came for the Commonwealth Organization Inter-Countries program, where we have come for the work that should be carried to all the countries without boundaries, especially Commonwealth countries, which are 56 countries which we have, and which is under the umbrella of the Queen of England, now the King of England now, and these aim of the Commonwealth Medical Association is to see, the education goes beyond boundaries. The medical education, the standard medical education, the Royal College physicians, the standard format to go towards the ends of the earth where, people practice medicine, English medicine, modern medicine. So it's our aim to see that through the collaboration with RCP, Royal College Physicians or Royal College Obs and Gynec or other British Thoracic Society. We are trying to, collaborate with all these countries involving artificial intelligence too.
Okay.
Because now the artificial intelligence is the main tool and the digital India or digital to all countries. Because as I come from India, I'm privileged to work for India. Involve India more in the digital platform hereafter. This is our main motto, to see that the medical care reaches without boundaries.
Brilliant. So before we get to the details of CMA and your role in IMA, Dr. Prabhu, I would like to understand, for my audience, I want to get a glimpse of like how you started this journey. Where are you originally from? And where did you, complete your graduation? Then up to you did your MD as well in UK. Then you went on to studies diabetics. In United States. So you did a lot of. So can we quickly go through your background?
Yes, I born in Nagarjun Sagar.
Okay.
Which is in the Telangana state.
Yeah.
And then I went to different parts because of my father, who worked as an engineer in electricity board those days. So I need to travel. But my father and their families, ancestors, they had their journey from Ongol, so a small village called Besthavarpeta, long back. Maybe, I'm the fourth or fifth generation guy. So it's been I born and brought up in most of my time in Hyderabad. I did my medicine in SVS Medical College, then did my internship in Gandhi Hospital, Gandhi Medical College, then worked in Usmania for some time. Came to London. By the way, I came to London. I was in Buckinghamshire, Buckingham University, doing my MD, worked in Ealing and Blackpool, Victoria, and I roamed around the whole parts of London, the United Kingdom, basically. United Kingdom consists of the London, the Wales,
Scotland,
the Scotland and Ireland, and I was in these three areas working, and then I have very good connections with Ireland too, Northern Ireland especially. I had good friends over there, so I traveled to Ireland most of my time. So that's where I did my MD here, MRCP, connected to London and Royal College Physicians from the beginning of my career. And then I did my endocrines from Johns Hopkins, USA. So then gone back to India. Okay. See, primarily the motto of my dad and my family or my mother is to see that every citizen gets the right medical care, the proper standard medical care. See, if you see India, till today, in a peak time, if you go to any government hospital, you'll see 4 to 5 patients on the bed. Still today, if you go in a peak time, you'll see really 4 to 5 patients on the bed and another 4 on the floor. So this is the pathetic situation from the ages which we are seeing, That's where I concentrated from
Isn't that changed, Dr. Prabhu? At least in the last decade or so, I thought especially the southern states of India have improved significantly with the healthcare.
The care has improved. Definitely the care has improved. But the scenario is the same.
Because of the population.
Because of the population. See, you see patients, till today we will see in the media, the boys and girls from different mountains or the tribal people are brought on the shoulders to the hospital, brought on a baggage to the hospital. And these are the sad parts which we look at. And this is where, Commonwealth even looks at. That's what I'm always passionate about. See, finally the aim is to see that the governments of all nations should take care of their health of their citizens, which should be on priority. Rather, now we see in different countries and different nations, not only India I'm speaking about, but different nations. We are proud of India, of all the heritage and that we are carrying. But at the same point, we should be also, considerately look at how we can reshape the health structure in India. We have all the basic, primary healthcare structure we have. Which is there till PHCs, primary healthcare centers, and then district healthcare centers, and then, the tertiary centers. But on the whole, what I see is that the change did not come to the levels. What I'm expecting is in a primary healthcare center, there should be the proper care should be given by a physician or a doctor or by MBBS doctor, because lots of doctors are coming out now. India, as you said rightly, that there is a growth in the doctors coming out. Young doctors are coming every year out.
Yeah.
But we are not providing them the job score there that they should get into those field. Because the field is ready, the doctors are ready, but the gap is not still managed by the government. So I request sincerely the governments of various countries, of these 56 countries, to look into that, because we are producing young graduates come out, and these graduates should get into that post and see that the primary healthcare structure should be improved. So that if the primary healthcare is improved, it is a backbone of the nation, that if you can improve the primary healthcare, the whole country becomes healthy.
I understand.
And many people say that it is a expenditure by the governments, but it is rather an investment by the governments for the welfare of their citizens and for the future of the citizens, for the future of the countries.
Yeah, healthy nation becomes a wealthy nation, obviously.
Yeah.
So, but yeah, one thing I do want to call out, Dr. Prabhu, because I hail from Hyderabad as well originally, but I've been living in London for some time. And by the way, welcome to London. And we met in Commonwealth Medical Association convention as well. We both met, we had a conversation, and I thought I should bring Prabhu onto this Candid Conversations to see how things are working in India and what is the healthcare. Primarily, Dr. Prabhu, what we notice, I live in London, so I don't live in Hyderabad right now, but what we hear in the news and all, especially in the last decade or so, last 5 years in Telangana, we have seen significant investment in the form of a lot of medical colleges. They now have 30 plus medical colleges in Telangana.
Yeah, we have,
which is incredible, right?
Yeah. So it's incredible and great. But the thing is, now the NMC recently has come, National Medical Commission has come and stopped the medical colleges, saying that you don't have proper infrastructure.
Oh, that's interesting.
That is the saddest part. See, here, having a medical college is different. Having a proper medical college with all the infrastructure, with all the facilities. So just going down and opening a medical college is very easy, very simple. But maintaining proper infrastructure, having proper faculty, having the lab facilities, having the necessary professors, departments, and then needful things for the doctors is very important. To train a young doctor, it is almost 1 crore.
Yeah.
Maybe 100 million or 1 million or 100 million.
Less than 100,000.
100,000, yeah. 100,000 pounds you need.
Yeah.
See, to make a doctor, such precious life is for doctors. So what I would really suggest is, as we are trying to make incredible India, when we are investing so much on the medical colleges, they should see properly that proper infrastructure is also maintained and managed. Now, recently, Honorable Chief Minister of Telangana has immediately took steps to see that these medical colleges, whatever the medical colleges now who are losing their permissions because the NMC has come and found there is no proper infrastructure, and it is already in media. It's not that I am talking new. This is already in media in India, and the Honorable Chief Minister has immediately taken steps to see that to renew those permissions again and see that proper infrastructure is maintained again. So what I am speaking is not, if you are looking at that particular incredible points, they should also reflect and throw their complete knowledge on those games, because India is becoming super nation now. India is becoming a top country over the nation. So we should also maintain those standards when we are growing in such a rapid growth is going on in India. So what I really look at it like, you should improve it.
True. No.
Standardize the medical care.
So let's come to role of IMA then in that case, right? I mean, you mentioned about all these infrastructure challenges and all, like which I completely get it, and it's an ongoing process for all the governments to kind of transition and
really,
work on this, which is good, happening at least. So one thing I noticed, which I felt good, was like erstwhile, like 10 years back or 15 years back, when you talk about Telangana as a state, you probably would have seen 4 or 5 medical colleges, which are growing up to 30 plus all. It's a great news for us looking at it. But let's look at the positive side of it. And second question I had is, like, when we talk about all these associations, I always had this question, when you talk about IMA or CMA, are these more like, in comparative, like I'm not saying this is exactly a comparison, but is it more like a Rotary club or something of that sort of doctors? Is it like all doctors coming together and doing things, or do they have authorized body which can go back to medical associations like IMA? Can they go and talk to health ministry and say that, can you change this? Are they part of lobbying? Are they part of policy making? What is IMA role primarily?
The Indian Medical Association is almost through its centenary celebrations now. It's a 100-year organization, and it is the world's biggest organization, because it is if we go to the history, it is called as British Medical Association in the beginning, and then it became World Medical Association in 1947, and in 1950s it has become Indian Medical Association.
Good.
So now we are going to a centenary celebrations of Indian Medical Association. That is a wonderful part. Now, many political parties, if you see, they have their own offices everywhere. Maybe in each district they have an office, or around 111 or something like that, around maybe 500, 600 political parties. But I'm proud enough to say you that Indian Medical Association is having around 2,500 branches over India.
Okay.
Now, we are more than a political party. We are a unity of doctors, association of doctors. From those days we are and we are always playing a very important role, a pivotal role in the government, explaining them the problems and all, how doctors are facing their challenges in the practice, how doctors should be saved. And all these things we take it forward, and also we see that how the primary healthcare structure should be maintained in each districts. IMA presidents or the members in each district for the collectors to see the government programs running. The central government projects are all go through into the interior, deeper parts of the world, especially in India, through Indian Medical Association. All these schemes of the central government, we take it forward towards the grassroots level. The saddest part any country is, when we are talking a lot and we are trying to give them more advice and, trying to put a lot of things forth to the government, it depends upon the ruler how he will take it forward. That's important, because they look at a lot of, even they have a lot of challenges to take, what not to take, because as I told you that, it is budget-based programs. So as we are developing country, there are challenges for the governments to...
But can we, sorry Prabhu, can we specifically talk about IMA's role instead of getting into government's case? Let's get into government's shoes later.
Yeah.
But what is IMA primary does? Like, is this
IMA always take care of the health of the state.
My question is, are you part of the policy making? Are you part of the execution? Are you are you a group of doctors coming together for camaraderie or acquaintance and all that stuff, and then doing some services to the society? What is IMA's primary role?
See, IMA does all these things. What you are talking, IMA does all these things. It is in the governance. It will advise the government. It will also execute the programs of the central government to the needy places, to the district levels. It is also part and parcel in the districts to give permissions to the private nursing homes and private hospitals, all the corporate hospitals. It is also takes every part. Like, we have programs called Aao Gaao Chelo. So we take all the medical advices and take, volunteer to take a village, adopt a village and help those people and, save girls and give them education and these kind of things, give them sanitary napkins. So there are a lot of social work which we have done. If you specifically look at, we do our medical part, medical services, we do our charity part. We also educate our young boys by paying their fees, young medical graduates. So there is a lot of diversities which we do.
Brilliant.
And IMA does a pivotal role in the whole India.
Okay.
So as I told you, we are the biggest professional body over the country.
Brilliant.
And having a big heritage and culture.
Like
legacy is going on.
Chartered accountants have their own organization, doctors have their own organizations, and
Yeah.
ICAI plays a role in kind of.
As I also again specifically say that it's up to the ruler whether he takes our advice or not.
Okay.
We try to put everything before the government. We approach the government. We in the state as well as the center, because we are at a branch route level towards the central level.
Federal level.
So we are everywhere, from top to bottom and bottom to top.
Brilliant.
So we are there from Kashmir to Kanyakumari. Everywhere.
You have chapters for each state, and then also you have chapters for, like for example, your chapter. Let's get into your details of your chapter now. So you are president of IMA Hyderabad.
Yeah, Hyderabad, Banjara Hills.
Okay.
I'm this, and then also I'm chairman for Anti-quackery, because quacks are a lot these days practicing medicine. As you said rightly, that there are a lot of doctors coming out, there are a lot of new medical colleges, and every year we are producing some 30,000, 10,000 to 30,000 doctors coming out, postgraduates, undergraduates, and all coming out of the medical colleges, and so much so that it's filled. We need to reach the public in the grassroots level, and there is no need of quacks in the country. And the other saddest part which we fight with the government at this point is mixopathy, crossopathy. See, the mixopathy is one saddest part.
Can you elaborate what it is?
See, mixopathy is something like the doctor treating, homeopathy doctor treating, allopathy doctor treating, Ayurvedic doctor treating, all groups of doctors treating a patient. In India, government is trying to encourage other groups of doctors, which we are not happy with. Because modern medicine is something where we deal with modern medicine. We love, we appreciate, we have great passion for Ayurvedic, we have great passion for homeopathy. We love them, undoubtedly. But what we say is you should have your own department where you are working. Don't mismatch all these things. Finally, it will hurt you, because what happens when you treat, Ayurvedic thing is a separate entity where it's having an ancient tradition, herbs and lot of stuff with that. And we really appreciate all those doctors, those universities which is working. We want them to be a separate part. Don't mix with English medicine, because this is a separate entity.
But
and then,
Dr. Prabhu, just to get there, I mean, it's a very interesting point you brought on, and I'm super happy that we are going to talk about this. Because a lot of my audience as well approached me, because I've been speaking to, for the last few episodes, I've been talking to a lot of specialists. Like I brought in Kumar.
Yeah.
You know Kumar. He spoke in the CMA as well.
Yeah.
He's a neurologist, and he's and then I had radiologists, I had other people, wellness people, and all that stuff.
But all your specialties under me, under one umbrella, all medicine, general medicine, and internal
I understand.
medicine. Yeah.
But my question is, so people, when we talk to as part of this research, we do speak to the patients as well, and they always have this concern that, especially in India, medicine has become lucrative, very, very expensive. If they're not going to the government sector, they're going to the multi-specialty hospitals. I'm not questioning one doctor here, but generally, in Telugu states, for example, if somebody is going through diseases like cancer or any orthopedic stuff and all, they're talking about almost in tens of lakhs of rupees. So it's quite obvious for the middle class and the lower middle class section to approach alternative ways. So if they're getting relief through a different aspect, like Ayurvedic, homeopathy, you call it, because they get it for a couple of thousands, right? I mean, it's very cheap compared to allopathy. What's your take on this? Is India serving medicine at the right cost? That's my question. And be transparent, please.
Yeah, I'll be always transparent. See, I've been transparent. I'm a journalist, basically, medical journalist from past 20 years. I've spoken a lot of these. See, I have to spend 2 crores on my mother's health for cancer, and I lost my mother just 20th of June. I lost my mother. Yes. See, but I have to spend myself for the pharmacy around 2 crores of rupees, which we have spent from our own pockets. You know how tough it is for me as a doctor. I have to buy one injection called Keytruda, which is a US-based injection, which is costing for 2 vials, it is costing around 5,000 pounds. You know, that injection I should give every 21 days because the last 1 year she suffered a lot, so we need to give that injection for about a year. So it costed itself a crore rupee for me. It's, as you said, 100,000 pounds in UK currency.
Yeah.
See, now you tell me it is the responsibility of the state to give that medication free of cost to the state.
Correct.
How come you talk about a corporate hospital? How come you expect a corporate hospital to give this treatment?
No, I'm not questioning any particular segment here.
That's what I'm telling
saying
you.
For an end user,
yeah.
if I'm a middle class person,
Yeah.
for me, I can't even talk about 2 crores, right?
Yeah.
I mean, see, if I have a mom at home who's suffering with cancer,
Yeah.
because you're a doctor, you're financially well based, you probably would have spent some money.
No,
but if
it's not financially well based. I have to grab money from everywhere. I have taken
I'm just
loans.
saying, yeah.
You know, I have taken.
Look at a middle class. It'll
Yeah.
be very difficult to bring them, like 2 crores is impossible for them.
Yeah.
So what's your take on that? I mean,
See, this is what I'm
medicine
talking
very,
now.
very expensive.
When you said incredible India, I'm looking at that part where the boundaries of the nation should get free of cost medical care.
Yeah.
See, the government hospitals, as I said, till now, if you go any point, take your cameras with your crew in Hyderabad, go and see at a peak time, you see 5 patients on the table, on the bed, and 5 patients on the floor.
Very
Still
sad.
today is the saddest part.
Very sad.
Not only in India and Africa, because I'm working in now as I have extended my horizon of working. My jurisdiction has increased now. I see even in Africa the same way. In other countries it is the same way. Which are the developed, underdeveloping countries, they have to get this medical care free of cost. Like UK and USA, they should get at least in USA they have insurance. In UK they have free NHS. Where they are trying to pay this, but the budget allocated in India is very less.
Okay.
This is the saddest part, where in India the budget should be allocated well, where in UK the budget is allocated very much for the healthcare, where it is not done in India. The same treatment we expect to be given in the government hospitals free of cost, where we even can develop more infrastructure in the government hospitals too, through the governments. That's what we are trying to ask the governments through IMA to implement all these things through government, because we don't want the corporate sectors or some other sectors to take over all these things. Because there are a lot of hospitals, like even here, if you pay insurance, you can go to the private hospitals and get the treatment, and that is costing you the same or more than that, what I'm speaking about. That's the reason medical tourism has so much developed in Hyderabad, that many people come from other countries. We have doors widely open for all the Western countries to come down to Hyderabad, and there are many organizations who are having international tourism, and they're doing very well with the medical tourism, and they're getting a lot of patients there. And I feel when patients tell me in India, they say that the patients whom I speak from, coming from other countries, and they say that we are just spending less than the countries which they have already spending.
Yeah.
If they want to get a consultation in
US,
so
for
in
example.
UK or US, if the consultation is in India for a doctor is just 1-2 pounds or 3 pounds on the top, or 5 pounds finally. Here the consultation itself in a private clinic, if you go to a doctor, it is around 500 to 1,000 pounds.
True. That is true. But the only difference with UK,
You know,
I've been living in UK for some time,
Yeah.
Dr. Prabhu.
Yeah.
And what I love about UK specifically in the healthcare is the kind of...
And I say you're lucky. You're lucky to be in UK and get all these things
NHS,
free.
yeah.
And I'm that's what the passion I have in going to India. See, in 2013 I left UK and went to India to see that this kind of help. That's the reason I have conducted more than 5,000 medical camps over Telugu states. They combined Andhra Pradesh and Telangana.
Brilliant.
I have conducted personally 5,000 medical camps to see that those tribal places like Paderu agencies, Maktal, Marikal of Mahbub Nagar, Karnataka, Adilabad interior parts where the MP is very close, a friend of mine there, the senior most farmer MP, and a lot of people, I have went to Warangal tribal areas, I went to, Andhra Pradesh tribal areas that's bordering with Orissa, Srikakulam, Vijayanagaram, Vishakhapatnam, all those bordering Paderu and all. There are a lot of places which I have roamed around where at the time, 20 years back when I went, there was no proper sanitation, no clothing, no facilities. Those days I worked in those places. And conducted all the medical awareness for them and did a lot for them. But I still look at what more can be done. That's the passion made me to come today towards Commonwealth Association also. That's where I'm into IMA, because on my whole I'm trying to do my best. But what best can be done going with these organizations, with these associations, and trying to bring towards the governments. We need to see that governments do all these things rather a single entity doing all these things. Now, as the Commonwealth Medical Association, now as Indian Medical Association and different parts, we can bring all forces together and see that the governments follow all these things, and also see that because government says that they don't have funds, so see that some companies come forward towards these programs and see that help the governments to do all these works.
Brilliant. It's amazing. So kudos to you and IMA for doing such kind of amazing work. And as you mentioned about a lot of Telugu names, so I want to mention I'm also Telugu and I'm more than happy మీరు తెలుగులో మాట్లాడిన ఒక ఈ స్టోరీ. Have you ever seen, మీరు ఇన్ని క్యాంప్స్ చేశారని చెప్పారు కదా, like you said you did about 5,000 camps and all. Can you share one or two stories from there? Like మీరు తెలుగులో మాట్లాడితే ఇంకా better. My Telugu audience will also understand. Is there anything that like kind of triggered that, here is my purpose? Like ఏదైనా మనం చేసినప్పుడు ఎవరైనా వెళ్ళి కలిసారు మీరు, ఏదో ఒక స్టోరీ ఉంటుంది మీ లైఫ్లో, అది జరిగినప్పుడు ఎలా అనిపిస్తుంది అంటే ఓకే దిస్ ఇస్ వై ఐఎమ్ హియర్, అలాంటిది ఏదైనా షేర్ చేసుకుంటారా?
A lot. I have hundreds of stories, but I tell you one story at least, or two stories at least, because we are time bound. I'll tell you some stories. See, we have seen a young girl, like she's around 4.
Which state is it? Like in Telangana?
In Andhra Pradesh.
Okay. You can speak in Telugu if you want.
నేను ఒక రోజు విజయవాడ వెళ్తే మా మదర్ ఆల్రెడీ నాకు వాట్సాప్లో ఫొటోస్ పెట్టారు, ఈ అమ్మాయికి హెల్ప్ కావాలి అది ఇది. వెళ్ళిన తర్వాత నిజంగా కాదని చూస్తాం కదా జనరల్గా ఇది ఎట్లా అని, ఆ పాప రోడ్డు మీద పాకుతా ఉంది. షీ హ్యాడ్ ఏ సివియర్ హెల్త్ ప్రాబ్లమ్. So it's called as after diagnosis we found as a renal tubular acidosis. Her blood becomes acid. It's a renal problem and her blood becomes acid. So she is
మామూలుగా ఏమంటారు సార్ దాన్ని?
renal tubular acidosis.
No, I understand. It's your technical term, but general గా చెప్పాలంటే
కిడ్నీలో ప్రాబ్లం వచ్చింది. సో ఆమె బ్లడ్ సరిగ్గా ప్రాపర్ గా ఫిల్టరేషన్ కాక మెటబాలిక్ ఎసిడోసిస్ అవుతుంది అనమాట. సో నేను ఆ అమ్మాయి ఆ పాప అరౌండ్ 7 years ఉంటే చూడటానికి 4 years లాగా చాలా క్రిపుల్డ్ గా చిన్నగా మెడ వంగిపోయి బౌడ్ బాడీ, షీ ఈజ్ ఆన్ ద ఫ్లోర్.
Oh my God.
I will share you the pictures also because still it's in my websites and different places. And she's crawling on the floor, and I went. She's on the road, just basically left over and all. So our parents pilpichanu, aa paapani తీసుకున్నాను చేతిలోకి. Her pictures are with me. Then took her into my hands and found she's very sad and all. Then I spoke to her and how old she is, I asked. I thought she's 3-4 years. But they said 7-8 years, something like that. I said, 7-8 years girl, if you see here in UK or in our families, the girl will be very strong and tough and all.
Correct.
It was pathetic. My mother was weeping for her and she's not happy with that. My father are into a lot of charity works because my father is electrical engineer and all. He was trying to help a lot of people in his time. And so Papan తీసుకొని when we started treatment with a pediatric nephrologist, with general medicine, me, myself and another doctor, nutritionist and all. We called for 3-4 people and now we need help because we need to do a lot of tests, run the diagnosis, what's going on and all. So this we aired in Gemini News at that time in a TV. I am very popular in the televisions in India. Yeah. As I told you, I am a medical journalist. I speak a lot in televisions and I have my own channels also. So then I took that baby and went Matadi. Gemini News program అయిన తర్వాత Vivek, and he's still there as a software company, he owns a software company, and that gentleman has come forward immediately and we all together and with some money myself and all we kept. So now we fixed some money for her and now she's growing well. It's now 20 years, maybe she's 18-19 years old.
Brilliant.
20 years maybe. And that girl is growing up and I have those pictures still and I speak.
What a story.
So this kind of
stories. When such kind of things happen, this tells you that, this is why I'm here.
Now, if we go to Adilabad, a place, I don't remember exactly, but still that's Utnur. That's a very tragic place. The water is not good there. Many people die with, kidney problems there also. And then I went personally there. We brought the water samples. That we took the water samples and we have sent it to the lab and found this water is not, useful for drinking. Then immediately we went to that village, spoke to the village, gave them the medications, care, and we changed the water. We have given them a water. That is also aired in all news at the time in Gemini and all other channels. So that's one Utnur Mandal in Adilabad. Now if you go to again, this is about Adilabad is Telangana, that is in Vijayawada, and if you go to Orissa borders, I worked in those places called Bhaderu agencies nearby, places called Vanabangi, Santa Mamadi, these kind of places are there, and we, the travel was like, we need to walk
There are no roadways,
crossing
right? There are no
crossing the
roadways,
small canals,
I know.
and then small walk on foot. There is no way, no transport. Even till today, there are some places like that in those
It's
places.
very sad to hear all this,
I
right?
crossed those places there, went to that end of that place, and they at the time they used to carry, because I'm thin at the time. When it was 20 years back, I'm very slim.
You're fine. You're
Yeah.
fine.
So they used to take me on their shoulders and cross me sometimes, and then we reach those places and treat those boys and girls, and they don't know about deworming. You see the small worms in the worm infestations in the abdomen. So that time when they go to poo and all, they don't think that they're living. They say that they're living with them. They don't know that these are eating their food inside in the abdomen, and they're giving trouble in the stomach, in the tummy and all. And we treated those cases, worm infestations and then lung infections, because of the cold climate they had in the mountains, and they drink the normal water flowing in the canal and all. So we taught them sanitation. So I have all these pictures, but over the years I was there
Great
like
work.
that.
Great work. Kudos to you and your association doing such an amazing work. So now it is a good segue to my next question, Dr. Prabhu.
Yeah.
One is, so there are two streams in the world, right? One where we see a set of the world, like almost 50% of the world, including likes of South Asia, East African countries, where there are a set of countries who are still struggling
Yeah.
for the basic needs.
Yeah.
You're talking about, not having basic infrastructure like roadways or, electricity. I'm glad, at least a decade or so, last 10, 15 years in India has seen significant progress. Hopefully it goes continuously. But there are still a lot of countries. You're talking about Commonwealth now, it's 56 countries. That's one segment.
Yeah.
And there's also another segment where you're talking about machine learning, artificial intelligence, agentic AI.
Yeah.
Completely different parts of the world,
Yeah.
right? I mean,
Yeah.
you are connected to both the worlds
Yes.
equally.
Yes.
My question is, I want you to think through and answer this in a way from the lens that even a common audience understands. You have this spectrum where extensive advanced technology. You have this spectrum where you don't have basics, served. How are you trying to balance these two? And is there a way that all this advanced technology can solve the problems of the basic?
Yeah. See, if you look at this thing now, the soft phones. If you see soft phones, they're available everywhere.
Yeah.
Even in the basic needy country where there's no food and no basic amenities, they have a soft phone with them.
Correct.
So this has gone viral everywhere, the soft phones. All we need is a soft phone for everything to happen. See, if you have a soft phone, in coming days, we'll try to give all these messages, all the YouTube videos to them so that they can read everything, how to handle this situation. See, that's what we are trying to do that, through RCP, through RCGO, and through other organizations of Royal Colleges. We are trying to go and advance this collaboration with them so that we reach those interior parts of the world. So that we can reach those 56 underdeveloped countries. Because, as I told you, I traveled already Albania. So I saw the pool. This is in Kenya, Nigeria. Some parts there because Kenya and Nigeria is almost like Hyderabad. When I went and saw that, it's all well developed and all. If we go deep into
rural
parts of Africa, they're very poor. They're literally on the sand and the mud, and they're facing a tougher situation. So we are trying to enhance these kind of medical support through RCPs or through other collaborations which we are having with those local medical associations like BMA, as we have here British Medical. Same way we have Zimbabwe Medical Association, we have other medical association over there. So through advanced medical doctors, we can reach those places easily. And through other community support workers, we can reach those places and also put all these AI-equipped things into that. See, AI will tell you more happily if we see. It's so great that AI will tell you how these people are if you ask them. So AI will give you all the feedback, all the information. And we can
have
help
more
those,
data points through AI.
And we can help those people more accurately.
That's true.
And we can understand the scenario through AI very easily. How this geographical condition, weather condition, what is the problems they are facing, health condition, through AI in this, and then we can help them more.
Yeah, one thing I noticed recently is one of my friends, again, he's a doctor as well.
Yeah.
He was talking to me, and he's a passionate young doctor who wants to serve the rural part of the India, and he studied in UK, but he went back to India.
Lovely.
To serve.
Yep.
So what he's doing is, they started building some AI solutions
Yep.
through which previously, whatever you like say, I mean, if you have to do a diagnosis, you need to have certain kind of equipment.
Yep.
Was the story 10 years back or 5 years back,
Yep.
right? Now the story has changed completely.
Completely changed.
You just need a smartphone
Yes.
to diagnose a lot of things, which is you rightly mentioned, Dr. Prabhu. It's amazing. So what these boys are doing right now is they go to rural parts of the India and they do diagnosis and they do it for free. They don't take any cost, and they come back and they do the analysis and then they start serving them from the cities. That's how they built it. And I think you're talking about the similar journey.
Yeah.
So is CMA
Yeah, we
doing
are
something in this area?
We are looking in that direction now.
Okay.
So we are trying to make all those kind of tools, or even a kind of small chip kind of things which we can manufacture and give to the patients, and we can monitor everything on phone
Okay.
in the office where you are sitting, and just monitor.
So they'll have wearable.
Yeah.
They'll wear it and you will monitor them.
Or if it's a kind of software, you just put it in their mobile and just get the information back through your mobile and see what's happening with him, and help them out. Even though they are in the other end of the world, you can just write the prescription sitting in your office.
Yeah.
Even now, through WhatsApp and all, we are trying to do that. With ChatGPT, we are trying to do that, sitting in my office here. Yeah, even though I'm here, I get all my prescriptions done here on my phone. I will send all the information.
True.
Most of my patients, they are sending their prescriptions to me, and I'm trying to type back, and they're sending their fasting, post-lunch blood sugars and everything. I'm trying to send them change the prescription immediately.
Yeah.
The same way we'll be doing with them, with the latest chips and all. So we are on that flow, and we are planning on that direction, that how we can get all these people together. Even we are planning a meeting in Hyderabad too. Coming days, we are going to take up this Commonwealth nations to Hyderabad also, to Telangana state. And
So you've been, by the way, congratulations on being elected as, Dr. Prabhu has been elected as convener for AI and digital healthcare for
thank you very much.
Commonwealth Medical Association.
Thank you.
I've seen that. I was there present in the Commonwealth Secretariat, right in the heart of the London. And there's been a lot of people. I mean, there was General Secretary of Commonwealth was there, and we had like Seema Malhotra ji, Minister for Home Affairs in UK, and there was a lot of other people, and we had Jailal, CMA President, all of them.
Professor Jailal.
Yeah. So brilliant, great work. So my follow-up question to that is, now that you have this role of convener and doing all of these countries, so you will have this role for a year or two, or like how does this work?
No, see, it depends upon the term of Dr. Jailal, Professor Jailal.
Okay.
The president, what he decides next, who should be.
Okay.
Will be the game with the professor, and I'm thankful to Dr. Jailal for the opportunity given to me.
Yeah.
He's a good mentor, and we have been traveling for about now
Number of
5-6 years,
Yeah,
and probably 7 years, something like that. But he's a great man that he loves to see work happens. He wanted to, wherever he is, he carries the legacy, and he will see that the work is done accurately, precisely, appropriately, disciplined, and lot goes with Dr. Jailal. So that I really appreciate in him, and I also thank him for the opportunity given. But
That's brilliant.
now the big responsibility.
What's your top 3 priorities, if I have to call?
See, if you see that top 3 priorities, I wanted to see I should carry this legacy first and carry 56 countries to be carried out with the AI. And then as priority, I want to conduct the program in Hyderabad, in Telangana state, in Hyderabad, about this AI, how to implement AI, how to get into the governments of into AI. That's the first priority.
And do let me know, because when you do that in Hyderabad,
Yeah.
and you would have seen like Neems Baro helps us in this developing this, and they've been kind enough to sponsor this program. But I'll be more than happy to bring all of the energy together so that we can help CMA as well.
And this the same thing we want to do in other countries also.
Other countries as well. Okay.
Like the 56 countries, if possible, in the period I have, I would love to see that 56 countries is reached at least in some points.
Yeah, at least once.
At least getting together, 3-4 countries or 10 countries coming together and trying to build those. The second priority is to build those equipments. Now they equip them. With these tools, with these intelligent tools, equip all those people. Now first bring them together. Second thing is put all these tools in their mind, then execute all that in their countries.
Yeah.
So that the needy and the people who are really suffering with no medical care, with poverty, And the young medical students who don't get this opportunity to get face-to-face contact with Royal College physicians or RCOG or something like a top, which will be a dream for young doctors to have Royal College on their tag. So all these things, the three priorities: first to bring them together, then get all these tools
Empower them
with the equipment, and then execute all these things in those countries. So this will be the three priorities, and I wanted to do this, in these 56 countries, in the time bound I have. That's a plan. That's a plan for the.
And while you do this, my only question is, like, now you're part of different organizations, right, Dr. Prabhu? So you're talking about IMA president, being IMA president of Hyderabad Banjara Hills, and you're also part of CMA. Then you're talking about Wise India. Then you're talking about
I'm also president for Wise Men
India. So how do you manage this? I mean, isn't it going to be a conflict or not conflict? Maybe. Your priorities may change. You might have to spend some time.
All these organizations having the same motto.
Oh, okay, that works.
Even I can mix all of them and bring at one platform also sometimes.
Okay.
So when we do this, we bring IMA, we bring CMA together, and we take it forward.
Okay.
So that's not a big deal, because our motto is to reach the unreachable and do the medical work with them, help them out, establish them, empower them, establish this thing with them, empower them, and execute all these things. The 3 E's will go forward with each of them.
Brilliant. And talking about India specifically, right? Because I'm a South Indian, we always go with the logics and statistics.
Yeah.
So one of the statistics I've been researching is how many doctors for a million people in India. And I was shocked to see the small count.
Yeah.
We are not even in hundreds.
Yeah.
For a million people, we don't even have hundreds of doctors.
Yeah.
So the larger questions comes here that how this tiny number of doctors are going to serve such a huge country. That's the reason when you go back to India, there are still people, the highest form of death, as in like cause of death, if you call out, right? I mean, we're talking about AMR.
Yeah.
They mentioned about AMR in CMA Convention as well. Yeah. And cancer is one of the biggest cause of death in India. And unfortunately, in the recent times, we see diabetes is growing significantly in India. Yeah. And we are calling it as capital of diabetes capital of the world.
The non-communicable diseases are on the rise. Not only in India, in all countries, I feel.
No, but I think India is leading in there. So what's your call on that? What's your take on that?
See, that's what, again, we want to empower people with the AI tools and see that now when there is that significant difference between the population and the doctors, where this AI comes into force and help the people to get, cut down the space, and see, this helps the work of the doctors comes down, the nurses and the doctors' works come down easily, so that they can do everything digital and help the patient who is far away. That is also very easy now because of the AI. But we need to empower these things so that this space can be cut down. Now, that's where we are looking at, and we are working on that, and see that most of the doctors are equipped with AI, so that they can handle a lot of patients on priority basis, important patients, because AI will help you to take up the emergency cases immediately, and then the next cases, and the next cases. So less prioritizing things will happen easily. Then they can handle the cases, more number of cases in a short span of time, and they can handle it easily, and the labor work comes down.
Yeah.
That's one thing. Second thing, the other part, which is like, nowadays the doctors' lives are at a stake, or doctors' lives, or many of the doctors, if you say, they are getting stressed out, burnout, and they're dying.
Yeah. So average age of the life capacity of a doctors in India is for 15 years. Yeah. Which is very difficult stat.
Now that's one important, which is a big problem going on. So that's what we are asking governments to see. Doctors get some benefits. They get some time out, taken care of. Because if you see the income of a doctor and the income of a saloon, if you compare that, the saloon income is more. According to latest statistics I'm speaking about.
That may be subjective.
That's what's happening. If you just go to a doctor, he is just taking £5 or 500 rupees consultation or 700 consultation. Whereas a saloon, he is earning more than 50,000 or 10,000, 5,000, 12,000. If you go for one person, the saloon is costing more. The charges of a saloon are more.
That's interesting appeal, Dr. Prabhukumar.
That's the reason I asked the governments to take care of doctors in their countries, because producing one doctor
difficult.
because doctors are dying. Doctors are dying very early.
Yeah.
There are a lot of suicidal tendencies. Doctors are stressed out and burnout, and they're dying. So I request the governments to take care of young doctors and give them, because for producing one doctor, even for London or for India, whatever it is,
It's a huge investment.
a thousand. It's
100,000.
a crore for
100,000 GBP.
Yeah,
Yeah, I know,
100,000
I know.
GBP for,
Yeah.
so they should take care of doctors and help them as much as possible and give them the liberty to live happily. So doctors really stressed out
Yeah.
everywhere.
That's a very good ask to close our conversation.
To the governments, I really request all the nations to look into that. Not only that, as you said, the prices are increasing and all these things. Government should take a lead on that and help the citizens to get the free medical care. That's another important point where I am very interested.
I know. It's all in policymakers' hands. I know it is very difficult, and some of the countries are doing it. At least half of the countries are trying to bring healthcare as a primary need and making sure that it's been given for free of cost. But yeah, Dr. Prabhukumar, thank you so much for great insights. I know it's a conversation that we can go for hours and hours, but we have to stop at some point. And a lot of insights, brilliant work from CMA. I have to call out CMA's work, and I have to call out IMA's work, and all that you are doing in Telangana state and Andhra Pradesh and all those states. And glad that you guys are expanding your horizons and going beyond India and doing the service, which is brilliant. But hailing from the same like India, I want India to grow well, and I hope all the initiatives that has been taken by CMA and IMA helps. Thank you so much, audience, for listening to us, and there is amazing stuff going out. Please do watch out various things that are happening in the space for medical care. And I would like to thank Neems Bureau Group for sponsoring this episode. Watch out for Neems Bureau. I'll share some details in the description as well. But other than that, I'll bring another doctor very soon. We want to cover various other topics in the space of medical healthcare. Thank you so much for watching this, audience. I'll see you again. Thank you.